What's the number one thing I hear from my patients as a skin cancer surgeon? I wish I had known. I wish I had known to sun protect when I was younger. That's the most common thing I hear from my patients when I am treating them for a skin cancer. And that's because most of the sun damage that will cause skin cancers when you're older actually happened decades earlier when you were a child and a young adult. So does that mean that all is lost? Not quite. Stick around for this episode where I'm going to break down what you can do to prevent skin cancers and what you can do once you've already developed sun damage. I'm Dr. Mina. I'm a board-certified dermatologist, and welcome to my channel, The Skin Real. This is where I give people real information about their skin health so that they can make informed decisions. Sound good? Stick around. This is my weekly recap episode where I break down my key takeaways from my recent interview with Dr. Abigail Waldman, who is a board-certified dermatologist as well as Mohs surgeon at Brigham and Women's Hospital in Boston, one of my old training grounds. And we're going to be talking about skin cancers and how we treat them and what you can do to prevent them. Now, I am a board-certified Mohs surgeon, which means I have subspecialty training in how to treat skin cancers, and that's a huge part of my practice. And just like Dr. Waldman, I'm mostly a referral practice. So I get sort of the bigger cases that need Mohs surgery, that are more aggressive or in more challenging areas to treat. I frequently don't see the skin cancers that can be treated with creams or scraping. So my patient population is a little bit skewed. But the good news is that for the overwhelming majority of skin cancers, especially things like basal cells and squamous cells, these can be very easily treated when they are caught early. And even melanomas, when they're caught early, they are very, very treatable. And that's, first of all, the great news, because these skin cancers are really prevalent and we're seeing the numbers rise every single year. And it's likely because people are living longer, and we see these skin cancers develop in older patients typically. And we're also spending more time outside. And as we're living longer too, we're having more of that cumulative sun damage. So the sun damage, it begins even in childhood. Even 2 blistering sunburns as a child before the age of 18 can double your risk of melanoma. That's huge. And 1 in 5 Americans will develop a skin cancer by the time they are 70. And these numbers just seem to keep rising unless we do something to prevent that sun damage starting in childhood and young adulthood. And so that's why I'm always preaching about the importance of sun protection. Now, sometimes people think skin cancer, it's no big deal, it's easily treated, you're not going to die from it. And for the overwhelming majority, that is true. But I would say it's not that it's no big deal, because even something that won't kill you, if you're having to come in and have your nose cut on, your cheek cut on, your eye cut on every single year or every few months, it can be really psychologically distressing for patients. So just because it doesn't kill you doesn't mean there aren't side effects or there aren't consequences. Even with the best Mohs surgery, if you are having your nose cut on every single year after year after year, there is going to be scarring, and it's going to be harder and harder to hide those scars. So again, prevention is key. Take skin cancer seriously, because you don't want to be coming into my office or Dr. Waldman's office all the time, especially starting out in your 40s, 50s, 60s, for the rest of your life having skin cancers cut off you or having to treat them with creams or scrapings. But thankfully, when caught early, very treatable for most cases, not all, but for most. It's important that if you do have a skin cancer diagnosis, that you talk to your dermatologist to really better understand, is this a skin cancer that is easily treated? Perhaps you don't even need surgery. Maybe you can treat it with a cream or a scraping if it's very superficial. Or is this a skin cancer that needs to see a Mohs surgeon? Is this a skin cancer that needs additional treatment after that surgery? So it's important to discuss that with your dermatologist based on the pathology of your specific skin cancer. And there's variability even within the skin cancer that you have. There are different ways you treat melanomas. The early melanomas can just be cut out. The more advanced melanomas need to have lymph nodes checked or need to have systemic therapy. And the same is true actually with squamous cells and even basal cells. There's a range of severity with more superficial basal cells being treated with more destructive things like creams versus an infiltrated basal cell that's definitely going to need surgery. So make sure you understand the type of skin cancer that you have and the treatment options that are going to be best for you. Now, I've kind of mentioned some of the options. We can destroy the skin cancers. That's usually reserved for those more superficial ones that are on the surface of the skin. We can either do that with a scraping or with a chemo cream or an immunotherapy cream that you have to apply. You can also cut out skin cancers. You can either cut out with what's known as a wide local excision, or you can cut out with Mohs surgery. That's a more refined way, checking the margins as you go along. And I get this question all the time, what about radiation therapy? It seems like radiation therapy is really being marketed not only to patients with commercials, but also to dermatologists. And this is actually an old treatment for skin cancer that is having sort of a resurgence. Now, I do sometimes use radiation therapy after I've treated a skin cancer like a squamous cell that has more aggressive features, and I will send someone to a radiation oncologist for that. But I do not typically recommend radiation therapy as first-line treatment for a skin cancer for a number of reasons, and I'm speaking specifically about something called superficial radiation therapy. This radiation therapy does not penetrate very deeply. And so if there is a deeper component to the skin cancer, it's not going to reach that. I also don't recommend it in younger patients because they have longer years for that radiated skin to develop a skin cancer within it. And here's the biggest misnomer about radiation therapy, that it doesn't leave a scar and that there are no complications with that. That could not be further from the truth. Radiated skin is scarred skin. And then if you get a skin cancer in that area in the future, that radiated skin is like a big scar and it makes it very hard to work with. So radiation therapy does leave scars. It can pull up structures like the tip of your nose or the nostril of your nose. It can leave indentations and white marks on the skin. And you have to go in every single day, sometimes for 4 to 6 weeks, to get the treatment. So it's not as simple as I think people think it is, or that they are marketed and told it's going to be. People think surgery, cutting, that's going to be harder, but radiation therapy also has complications and side effects as well, and typically not my go-to treatment for most skin cancers. Sometimes it's added on with surgery. Now, in this episode, one of the things I really like that we talked about is prevention of skin cancer. And I am always preaching this. I'm telling people, wear your sunscreen, sun protect, put me out of a job, right? Let me retire early. But unfortunately, the message is still not resonating with a lot of people. But sun protecting is the best way to prevent the overwhelming majority of skin cancers. Most of these are highly preventable with sun protection. Not all, but most of them. So sun protection, starting out even as a child, as a young adult, is so key in preventing this sun damage. So sun protection involves several things. Wearing sunscreen every day is a great way to sun protect. Make sure it's SPF 30 or higher and says that it's broad spectrum. Make sure you wear it everywhere you have exposed skin. I'm a big fan of hats and sun protective clothing. So when I'm outside at the park, going on a walk, I make sure that my skin is covered. I might throw on a little sun protective shawl or wear a hat with a brim. I make sure that I don't have any exposed skin just frying in the sun. You can wear gloves while you're driving if you spend a lot of time in the car and you feel that sun beating down on you. And then just making smart choices like not to go outside when the UV index is highest between 10 a.m. and 2 p.m. or sitting under shade when you have an option at a restaurant or at the beach. So things like that, they really add up. These simple little choices that we make day in and day out will help prevent skin cancer and sun damage down the road. So sun protection is key. Now, some of you listening may say, well, then it's too late for me. I didn't do that when I was younger. We didn't know. I burned. I went to tanning beds. It's not too late. all is not lost. Don't give up. Of course, right, the saying is the best time to plant a tree was 20 years ago, but the next best time is today. So it's not too late. Start today making safe sun protective choices with your skin. Your skin will thank you in 5 years, 10 years, 20 years. I promise. So what can you do now, though, if you have sun damage? Maybe you've already had skin cancers. Maybe you're getting those little pre-cancers that have to be frozen off. There are some treatment options. So one of the things that we will do in dermatology is do something called field treatment, where we kind of clean up the skin to remove any pre-cancers or early skin cancers. And we can do this a few different ways. One of my favorites is to use a chemotherapy cream called 5-fluorouracil, or we shorten it to 5-FU. I like to mix it with a vitamin D analog called calcipotriene, and it gets compounded together, and you basically apply this cream twice a day to any area that has had some sun damage or these pre-cancers. You put it on twice a day, and anything that is abnormal, any abnormal cells, they will grab onto that and they will be destroyed. So as you're doing it, your skin will get red and crusty and inflamed. And it sometimes can be very pronounced. And so I usually don't recommend people just treat their whole face at once. I'll tell people to treat in sections, especially if they have a lot of sun damage. So perhaps treat your forehead first, twice a day for 4 to 5 days. The skin will light up, and then those abnormal cells will be removed and destroyed, and you're left with healthy skin underneath. This is a great option for sort of cleaning up the background noise and preventing future precancers and skin cancers. Another option is to do something called photodynamic therapy. It works in a similar way where you use light with a photosensitizing agent that you apply on the skin, and then you sit under a certain wavelength of light, and then all of those abnormal cells have preferentially grabbed onto that photosensitizer, and they are destroyed. You are red, look like you have a sunburn for a little bit of time, but then you have nice, healthy skin underneath. Another option is chemical peels. I'm a big fan of chemical peels. I love them not only for the rejuvenation benefits, but they also can remove precancers and early skin cancers. Same sort of deal. You apply a medium depth chemical peel on the skin, and then that whole top layer of skin is removed, removing abnormal skin cells as well, and you have healthy, fresh skin underneath. The problem with chemical peels, insurance typically doesn't cover it, and it's usually out of pocket, but definitely a great option, especially if you are looking for a rejuvenation option as well. Recent studies have also shown that doing a fractionated laser treatment can actually improve not only your skin for rejuvenation purposes, but also decrease precancers and skin cancers. And the way the fractionated laser works is that it uses actually thermal energy, pokes these little channels in the skin, and then as they heal, they remove the abnormal skin cells, and you're left with healthy skin underneath. Again, just like with the chemical peels, this is definitely not covered by insurance, so be prepared to pay out of pocket, but this is an option, especially for someone seeking more rejuvenative benefits as well. The last preventative thing I want to talk about is a B vitamin called nicotinamide or niacinamide. They go by the same name. It is a B3 vitamin. It's an oral supplement, and when you take 500 milligrams twice a day, some very good studies out of Australia have shown there's actually a reduction in the number of precancers that someone gets, as well as skin cancers. Now, I tell my patients when they take this, it's not a magic pill, and it doesn't mean you're never going to get another skin cancer, but I do find it reduces the number, and it's very safe. Most people can take it without any side effects, and it is a good option, just another option for people who are trying to decrease the amount of sun damage that they have and decrease their risk of skin cancers in the future. So if you have a history of skin cancer or have a lot of sun damage, make sure you talk with your dermatologist about doing some of these options to help decrease your risk of developing skin cancers in the future. And of course, start sun protecting today. It's not too late. Make sure to wear sunscreen, wear hats, sun protect. And any new spot, something that's not healing, looks unusual, make sure you show it to your dermatologist, because when we catch them early, Most skin cancers can be easily treated in our office with a very high cure rate. If you want to hear my full episode with Dr. Waldman, be sure to check it out here, and I will see you next week.